If you're having shoulder pain and you've been given a diagnosis that you're trying to understand, you've come to the right place. On today's video, we're going to get deep into the shoulder joint, bursitis versus rotator cuff tendinitis, how to tell the difference, how we manage them, and more. Hey everyone, I'm Burke. I'm a physical therapist and an orthopedic specialist. If you're new to the channel, this is a place that I want you to feel at home, getting answers to questions related to your body, rehabilitation, injury prevention, and I am giving you knowledge, tips, tricks, strategies that you can use to ensure you're going to have a comfortable experience. On today's topic, shoulder pain, specifically bursitis versus tendinitis. This topic is near and dear to my heart for several reasons. One, I have had shoulder pain myself in the past for a bunch of different reasons from a bunch of different sports injuries, and I know this problem firsthand. I know it well. Secondly, most of my friends that are active have some degree of shoulder dysfunction, and it affects the things we love to do. It affects our climbing, our surfing, our paddling. Anything that we do with our upper bodies is impacted by shoulder pain. If you are suffering from shoulder pain, I want to help you. I'm going to provide you a quick outline today of understanding bursitis and tendinitis and how they relate and how they're different, to give you some ideas if you've been given a diagnosis of either one of those things, to help you make better decisions about your care and what you need to do to get yourself better. Let's start with bursitis. There are basically three kinds. One kind is infectious bursitis. That's when that little bursal sac gets infected. We're not going to deal with that today. That's a different problem. If your shoulder pain is associated with an injury to your skin, a cut, an abrasion, or some other cause, an insect bite, and you have not just pain, but redness, swelling, and the pain is severe and it's unrelated to your activities, just go to the doctor. Get yourself checked out to make sure that it is not the infectious kind. Let's back up a moment and talk about that little fluid-filled sac that I just mentioned. That is a bursa. We have them all over the body, and they basically sit anywhere you have soft tissues in close proximity to rough surfaces of bone. Now, when a tendon attaches to a bone, it attaches via a bunch of little plugs. That tendon is soft tissue, and it sends these little plugs into the bone, and that's what anchors it there. Where those plugs are, that tendon is creating some pull, and that pull causes bone to grow, because bone is living tissue. And where it grows, it creates kind of a rough surface. So that particular rough surface on that bone can be an irritant as you move, as you go about your movements. Your soft tissues are traveling over those rough spots, and we have them all over our skeleton. And so anywhere you have the potential for that kind of friction problem, our body has grown these bursas. They're little sacs, they have fluid in them, they have blood vessels and nerves, and that's important, and we'll loop back to that a little bit later. And they serve to protect our soft tissues from injuries from our own bone. But that's not all they do. It's become more clear over the years that the bursa also provides nutrition for those tendons. So we used to think years ago that they were just cushion and protection. Now we understand that that blood supply is like a little watershed for your tendon. And that watershed helps nourish that tendon and helps it heal when it's injured. So of the two remaining kinds of bursitis problems, one is acute and the other is chronic. And in the case of a chronic tendinitis, we will often see a chronic bursitis. And that's when the bursa has grown, it's swollen, and it might even become a little thickened because it's been working so hard for a long period of time to nourish an injured tendon. So that's the second kind of bursitis that we'll chat about today, is chronic bursitis. And it is always associated with tendinitis. If someone says you have shoulder bursitis, and you don't fit into the category of acute bursitis, which is our third category, then it's likely you also have tendinitis. And so we need to couple those things together, treat them together. As I just said, the third kind is acute bursitis, and this is always associated with what I call a smoking gun. A smoking gun is a repetitive motion. Classic repetitive motions tend to be overhead, but they don't always need to be. Here's an example. Painting the ceiling of your room is an example. Cleaning your car repetitively for a period of time. This is basically tissue overload. Things swell in the joint, there's friction, there's rubbing, there's breakdown, and when anything breaks down in the body, it triggers an inflammatory response, and that inflammatory response causes it to swell, causes it to become painful while it is healing, and that's this third kind, acute bursitis. But let's talk about chronic problems first. If you have bursitis, one of the primary causes of that, as I mentioned earlier, is a problem of the tendon, tendinitis. The bursa feeds and nourishes that tendon, and when the tendon is strained, when it's degenerating because of overuse or poor habits or lack of activity, a whole number of reasons, the bursa is just overworked trying to feed that. The second component of this problem is postural. So if we break down chronic bursitis into a few different categories, and these categories will help us provide treatment, one category is overuse, that's chronic and repetitive. Repeated strain, not good enough healing, not good enough blood supply to that tendon. The bursa is stepping up to fill the gap. The second primary driver of chronic shoulder dysfunction is postural. The shoulder joint has incredible motion, and that incredible motion comes at a cost. That motion is derived from the balance of muscles and tendons across the shoulder joint. There's not a ton of bony stability, unlike other joints like your hip joint, for example, your knee joint. These joints are very stable because of the bones, the way the bones are shaped. Not so in the shoulder. The shoulder is totally free to move, and that puts more demand on the soft tissues. If over time our activities predispose us to an imbalance of those soft tissues, such as using the computer, driving a car, cooking, eating, cleaning, all the things that we do tend to be these forward types of motion. Over time, that creates an imbalance where the joint actually shifts within the socket. And that shifting within the socket means some tendons are going to be predisposed to strain. And so the second driver of these chronic shoulder bursitis problems, bursitis/tendinitis, is poor posture. And so some of the solutions that I provide as a physical therapist are postural solutions. They are slow to act, slow to create change, but they must be done. We have to change the posture in order for the shoulder tension patterns to be adjusted enough to take stress off of those tendons and the bursa. And the third and last category we'll talk about for chronic problems is self-use. Self-use means how you move your shoulder and arm. Often I'll get folks in the clinic with me who are asking me to help with their shoulder problem, and they'll say, well, you know, every time I do this type of move, it hurts my shoulder, or every time I reach across like this, it hurts my shoulder. That's not the way to go. That particular movement with our thumb down, it basically rolls one of the bones where our tendons attach right into this bone up here on top, and that causes compression and pain, something we call impingement. Impingement can be caused by tightness in your shoulder, and it can also be caused by looseness in your shoulder, something we call primary or secondary impingement. I know this is a lot of information. You doing good? Are you holding up okay? I'm downloading the goods for you here because I want your shoulder to feel better. So let's loop back to that third cause, self-use. The key here is to rebalance the tension around your shoulder so that you're using your shoulder properly. And if you have habits, Here's a habit: laying on your shoulder with your palm down like this. You will need to avoid those habits for a period of time. I won't say forever, but I'll say for a period of time while your shoulder calms down. So that is chronic bursitis, super quick. So for acute problems, these are going to be self-evident because there should be a smoking gun. You've just done something and your shoulder has blown up. It is super painful. When that happens, it's going to hurt to do just about anything for the first few days. And in that period of time, anytime you activate your muscle, anytime you put tension through it, you're going to compress that painful swollen bursa and it's going to hurt. So most people will naturally on their own try to avoid doing movement. And that's generally a good thing for just those first few days. This is the time where we use hot and cold. If you have pain problems with that amount of pain, people will take over-the-counter pain medication. So we'll treat pain, hot and cold. I will tape the shoulder sometimes to try to provide a little relief. Just from my own experience, taping at that stage, I'm not really sure that it does a ton. It sure can be helpful later on, and especially for chronic problems, to change your shoulder posture. But in that acute stage of acute bursitis, those first few days, you could try taping, but it's not the be-all, end-all. The last thing we're going to look at with acute bursitis is range of motion. Shoulders are designed to move and they suffer if they don't get enough movement. And so when we have a shoulder injury, as a therapist, one of my big concerns is, are we moving the shoulder enough to prevent future problems? In the case of bursitis, it's going to be so painful, maybe quite hard to move. And therefore, we're going to use the most gentle kinds of movement, something called a pendulum, little bent over rows without any weight. We're not doing any resistance. We're not doing any weight. We're just trying to get that shoulder moving. You can lay your arm on a table and slide your arm slowly back and forth. Basically work within your pain tolerance. And as that pain level subsides, getting back to the motion should be quite natural. Now, this is an important point. As you are feeling the bursitis pain subside, the pain that is exquisite, that triggers painfully every time you try to move, as that subsides, it's possible that something else is going to rise to the surface. And that something else could be another structural problem. Whatever injured your bursa acutely in the first place may have also injured your rotator cuff or your biceps tendon. The rotator cuff, and I've mentioned this in previous videos, it encircles your arm bone and it basically helps center your arm bone while other more powerful muscles do the job of moving your arm and supporting your arm with weight. So the rotator cuff is a stabilizer and it holds everything in place. If you are finding pain that's in the very front of the shoulder right here, we're going to look at that biceps. So those are our primary management strategies for acute bursitis. 1, we're just going to try to calm things down. 2, manage the pain. 3, do some gentle range of motion, and the bursitis should pass. It might take 5 days, it might take 7 or even 10, but within a couple weeks, I'm really looking for that to subside. If it doesn't, then we need to look at other things. We need to look at other structures that may have also been injured in this action, this injury, this activity, whatever it was that set you off. In my case, I was fortunate. I had done a repetitive motion. It caused this huge flare-up, which was absolutely miserable. But by the 3rd or 4th day, I was doing these little muscle tests. Once I could get my arm a little bit away from my body, it was still super painful, but my muscle tests were pain-free, meaning I could activate my rotator cuff, I could activate my biceps, and that didn't cause worse pain. So the pain was primarily with movement. That's important because that's a distinguisher. If you're trying to figure out, is this just bursitis or is it bursitis plus some tendonitis? Once you're past that real fresh acute stage, that's how, as a therapist, I will start to dive into that, is by testing against strength at different ranges of the shoulder. And if you can test strong, even though your shoulder is still quite painful, the likelihood of really damaging those tendons, at least with that injury, is fairly low. So that should be reassuring. If, however, you have this problem and you go to test strength through these different movements and you just don't have strength there, it's either painful or you just don't have it, it's weak, then we're thinking, gosh, either this also caused a tendon injury or muscle injury, or there was a previous muscle or tendon injury that was quiet that has since emerged. Either way, if you test weak, if you don't have it, or you test very painful to resistance after your 5th day, you need to go see a doc, you need to go see a good physio who can help you more accurately diagnose what's going on with your shoulder. 2 more topics. I hope you're hanging in there because this is important stuff. Next up is, what can you do? How much can you push this? So the short answer is, I don't really want you to push this at all. When you have bursitis, it's not a muscle that you're going to remodel through use. This is a soft tissue structure with a lot of blood vessels and a lot of nerves. And the more you push into it, the more you try to work through things, the more irritated it is going to be. So don't push this. The example we use all the time in the clinic is biting the inside of your cheek. Have you ever done that? You bite the inside of your cheek and what happens? You bite it again because it swells a little and all of a sudden it's closer to your teeth. So that's the situation here. When you have bursitis, and this is true for other bursas in the body, it's not just the shoulder, you really have to be nice to this. Don't tick it off because that's not going to help it heal. It really needs to get small back to its normal, healthy size and function in order for you to be able to progress. So if you're considering, well, should I just climb anyway, or paddle anyway, or keep painting the house, or whatever it is, no, you need to take a break until that is better. And the last topic is a dovetail on that. How long is it realistic to give it? If this is an acute problem, I'd like to see you most of the way through this within 3 weeks for sure. 3 weeks is considered the end of the subacute phase. So your body has basically patched up whatever may have been torn or irritated in there. And from that point forward, your body is just basically maturing some new scar tissue. And so that process can take a while. So you might be sensitive for months, but the actual acute stage should be over by about 3 weeks or so. If you're feeling like you are just not making progress by 3 weeks, definitely go get yourself checked out. Once you are past that 3-week mark, gradually try resuming your activities. If you can feel your bursa a little bit or your shoulder a little bit when you do them, but after you're done, you are not any worse, then it's probably okay to continue just at that level. Don't necessarily push yourself much further past that. 3 weeks is a good time to reintroduce strengthening. You could do things earlier, and as a therapist, I will coach people to do some pain-free, super safe exercises really from the very beginning. Whatever I can get away with that's not painful and is not going to compress or irritate the bursa, I will. But for you at home, I'm going to say give yourself 3 weeks. Just do range of motion. You're not going to lose a lot of ground in 3 weeks, so it's okay to wait that long. As you get a little further along and you try to resume your normal shoulder exercises, if you have trouble with anything, follow my guidance from just a moment ago. Don't push it, just give it a little bit more time. Folks, that is it in a nutshell. A lot of information on shoulder bursitis. I hope this has been helpful for you. I'd love to bring you this content. If you find this useful, give me a like and leave a comment in the comment section below. That helps other users on YouTube find this information. And I hope to see you next time.